When I released my first book, I remember thinking very heavily about Elin Harris and how he did it, how he managed to reach millions of people around the world through his work, and how I would do it. His readers became my readers. I write because it's my passion. I write with black people on my mind and black gay men in my heart. Toni Morrison gave me the courage to say that out loud.
Yes, I can write about white people. White people can write about black people. Anything can happen in art. There are no boundaries there.
I could write about anything, anyone, but I choose to write about our experience.
And I've spent my entire writing life trying to make sure that the white gaze was not the dominant one in any of my books.
Book of Jewels is my love letter to black people.
It has nothing to do with who reads the books. Everyone, I hope, of any race, any gender, any country.
Book of Jewels is 11 of the biggest life lessons that I've learned to date, and the stories behind those lessons. Book of Jewels is available now on Audible, all e-readers, and Amazon.com. Visit www.craigthewriterstewart.com for more information. This is very personal work for me.
Politics.
I believe I was called to tell my story, use my voice, be a voice for the community, to speak to and for a community of people that's been ignored, denied, overlooked.
Religion.
This is my life's work.
Religion.
I want to use words to uplift, heal, inspire, encourage.
Do something different. Every Monday at 10.
Good day, thinkers, thought leaders, progressives, and dreamers. I'm Craig the Writer Stewart, and this is So Much to Say. These are my thoughts in my voice on black shit, white shit, gay shit, and everything in between. Now listen, this is the very first time that I've actually recorded a podcast in a moving vehicle. I'm in Washington, D.C., and I'm with my friend from Hampton University, my friend Dr. Tasha Young. At the time, she was Tasha Williams, but she's now a Young, and she's now a doctor. But she's a doctor of podiatry, and I wanted to have a conversation with her because we've been having conversations about the importance of foot health. And she was saying to me in a conversation that oftentimes black folks don't prioritize the health of their feet. And they don't really consider their feet until it's too late, either because their toes have started to get black and they need to be amputated, or the same thing with their foot as a result of like diabetes or other things. So I want you guys to welcome my friend, Dr. Tasha Young.
Hi. I don't know what to say. I'm new to this, so please forgive me.
So anyway, Tasha and I went to college together, but I used to see her on campus, but I didn't know her. Like, I don't know if I knew your name or not at college, but I definitely used to see you in your 9 West sweaters and things. But
you always go back to that.
Well, she doesn't wear anything close to that now. So what made you want to be a doctor, first of all?
Well, I always enjoyed medicine, and I always enjoyed the visits to my pediatrician. And when I spoke to her, she mentioned to me that, she studied math and science. And I said, well, I'm good at those subjects, and I really liked it. And so she basically kind of gave me a pathway and laid down the groundwork for me because I enjoyed math and science. And because she was so nice, I kind of was like, oh, okay, well, I think I'll be a doctor.
So what made you want to get into podiatry? Because, that's one of those things, like, people always say to me, oh, my God, you're like the only person that I know that have actually published a book. But I have to say, I know some doctors, but I've never known a doctor of podiatry.
Well, it started, originally I wanted to be a pediatrician like my pediatrician. Uh-huh. And so after I graduated from Hampton and I was studying for the MCAT, I went and shadowed a pediatrician at his office in South Carolina because I was in grad school at South Carolina State. And when I was shadowing him, I was just heartbroken. All the ped cases. And when I said, I think I spent like 2 or so months there. And I cried almost every day.
Why?
I mean, sometimes you have fatal diagnoses. You have the parents are sometimes difficult to deal with. Ailing kids. It was just emotionally draining for me.
Okay.
And so I said, well, Lord, I can't do this for 30 years. What else can I possibly do? And so it just so happened I went into the cafeteria and I met a podiatrist, and I'm thinking, oh, I don't think I want to do that. But, what the heck, I'll just go and shadow you for a couple of weeks. And when I went there, I absolutely enjoyed it. I got to see the peds. I got to see every,
The what?
Pediatric patients.
Oh, okay.
Sorry, peds. Pediatric patients, older patients.
I knew what you meant, but I wanted, communication is our partner, clarity is our friend. We have people that are listening.
Okay, right.
Go ahead.
Again, this is my first time. Please forgive me.
Yeah,
So
that's why I wanted to correct you. Go ahead.
So spending time with him for those 2 weeks kind of woke me up, and I enjoyed it. Like, I literally was excited to wake up the next day to go back to his office, and he was just a really good mentor. And so that's how I got into podiatry.
So you never were like squeamish when it came to like surgery?
No.
Or, because some people, even aside from surgery, like some people don't like feet. Like They don't even like to look at feet. They don't like their feet to touch you or your feet to touch them.
Trust me, there are worse things.
Right. So you weren't ever squeamish about like having to saw? Because like you have to cut. Like you have to cut sometimes like bunions and...
Yeah, it's almost like carpentry work. I mean, essentially, you're using screws and plates.
Oh my God.
And yeah, it's like carpentry work. And essentially, that's what my medical director told us. Essentially, this is what it is. When you're going to do podiatry surgery, you're going to use a blade, you're going to use a saw. Sometimes you have to chisel.
And you've never been like squeamish, like, oh my God, I'm going through the bone. Like
the only time I had one incident, and it wasn't really like squeamish, I just felt really bad for the patient, was I had a patient from the VA, and he came into the ER, and I think it was a Friday evening. And when I say, Craig, I could smell this smell.
I remember you telling me this.
And so that's the only
smell
time.
from his feet.
Yeah.
But it wasn't his feet like fungus. It was more like pus or something. Like an infection?
He had maggots in his foot. It had eaten away half of his foot.
Now, he was homeless, right?
He was homeless. Again, a veteran.
Right.
So, yeah. I mean, that's the only time that I've ever felt like uneasy in the front of a patient. Other than that, I don't have any
And
issues.
so his foot went untreated.
Yeah.
For so long.
Because again, I mean, he had the shoes on and he was homeless. So they don't take their shoes off to wash and do hygienic things. And so, yeah, I don't know how long it had been that way, but it was really a sad case.
And so you had to remove his foot?
Yeah, amputate. Yeah.
So you went to grad school in South Carolina, but you went to medical school at Temple.
Correct.
Okay. And so once you came out of grad school...
I only did 1 year of grad school because then I did my MCAT, then I got accepted to Temple.
Okay.
After the first year. So I didn't get my master's.
Okay, so you went straight to medical school.
Correct.
And then how long after graduating medical school was it before you got your first job?
Well, after medical school, you had to do residency. So I did a 3-year surgical residency.
So that was right away?
Correct.
Okay.
And then after that, I was able to,
Now, how long after coming out of residency was it before you got a job? Was there like a period that you had to wait?
No, because they prepare you for that. They help you get your license or talk to you about getting your license, whatever state you want to work in.
Uh-huh.
And so all that was in motion before I actually graduated. And then, of course, people know that when you're graduating from residency, people are looking for places or looking for fresh graduates.
Right.
And so there is there was almost like a directory of people who were looking for podiatrists, new podiatrists. And I found one, actually worked in Manassas for a while underneath a group.
Okay. And so you were working then and now for like a hospital, not a private practice?
Correct.
Okay. So have you ever considered your own practice?
Now, I do have my own practice. On the side, I go to senior living places. Mm-hmm. And so I do that on my own.
And how do you find patients that way? Do they just kind of reach out? Is there some sort of a resource where they find doctors for their
initially
patients?
what happened is for me, it was word of mouth. Mm-hmm. Some people do go out and solicit themselves. But I started at one particular place. And I think that the one that I started at... I think the girl was an alumni of Hampton. Mm-hmm. And so I started working there, and then from that, she was really impressed with me and how I took care of the patients and, my timeliness and all that. And so then she referred me to another one, and from there, people were just calling me saying, Dr. Young, can you please come to my facility? And so it's something I juggle early in the morning or in the weekends.
Mm-hmm. And so you set your schedule for that?
Correct.
Now, but you're sometimes on call, so like sometimes somebody may have an emergency.
Right.
What kind of an emergency would that be? Like 4 in the morning or something? Usually
it's diabetic ulcers. Sometimes it's fractures.
Now, what's a diabetic ulcer?
So when diabetics get ulcers, basically it's too much sugar in the bloodstream. Mm-hmm. And so the sugar causes the body not to heal as quickly. And so usually by the time the diabetics get an ulcer, the healing rate is slower, the infection rate is intense, and most of the time they don't feel that or know that they've had an ulcer. A lot of times they get ulcers on the plantar aspect, which is the bottom aspect for their foot. So if they don't check their feet and their blood sugar is very high, chances are things from like a callus can turn into an ulcer, which can then open all the way up down to bone. And this is why they get amputations and such.
Now, when you said the plantar section of the foot...
That's the bottom.
Yeah, because it's like plantar fasciitis. Plantar fasciitis. Now, what is plantar fasciitis for the people that are listening that don't
Plantar fasciitis is basically, the fascia is a ligament that basically holds up the arch. So it starts in the heel and extends into the toes. And if you gain weight or you don't stretch or you have falling arches, that fascia stretches. So every time that you go to make a step, it stretches out. And usually it's after rest when people have the most intense pain, because usually the foot kind of contracts, the fascia contracts. Mm-hmm. And when you go to make that first step, it's immediate. And so it stretches and it tears, and that's caused the pain. It's very common, but people don't know that a lot of times that a lot of those kind of diagnoses can be solved with proper shoe gear. Mm-hmm. And unfortunately now it's hard, even with my 3 daughters, it's hard to get them to wear shoes that are good for their feet.
And what do you mean shoes that are good for your feet?
Supportive shoes, ones that are not flimsy, ones that you can't bend and twist and fold.
Like those Converses, like Chucks.
Correct.
Chuck Taylors.
They keep me in business.
I wanted to go back to something that you had said earlier in a conversation that you and I had before, where we were talking about a lot of black folks don't really go and see about the health of their feet. And a lot of times the issues that we face are as a result of our diet. So it's like as a result of diabetes or things like that. So would you say the majority of your patients are non-black?
Yes.
And why do you think that is?
I just think it's the location. I'm not in a predominantly black area.
Okay.
So, but the ones that I do see are a little bit more upscale. And I hate to, generalize it, but they're more upscale, so they're more aware. But when I first started my practice, it was a challenge to, educate them and inform them of, just basic foot care, checking your feet out every day, not waiting until something happens to go see somebody. And a lot of things can be prevented, again, with maintenance, with shoes, with braces. So
now, what are some of the most common issues that you see in your office?
Fractures are very common.
Like little subtle fractures?
Correct. Like people most of my patients are very active, so they're runners, so they may have a fracture of the metatarsal, which is a stress fracture, because the shoes may be worn down or it doesn't have enough shock absorption.
And the fracture is typically on what part of the foot?
The middle part.
Okay.
The long bones are usually
on the bottom of the foot.
Correct. Well, not necessarily the bottom.
It could be okay.
Yeah.
But how would you treat that? That's not something that would require surgery, is it?
Well, it depends. I mean, fractures can be displaced. If they're displaced and angulated, of course, you have to reapproximate and put the bones back together the way that the bone should be so they can function. But if sometimes stress fractures are just a little break, and you can just rest, immobilize it for a couple of weeks, and then they're back at it. But if it's actually broken and turned and angulated, then of course you need to have surgical intervention.
But in terms of foot issues that stem from diet, how common is that? And how often would you say that you have to amputate? Or amputate like a foot or toes? Well,
I wouldn't say... diet plays a role in the sense of healing. Okay. So, for the most part, if you are, a smoker, or you have a high caloric intake, or you have a lot of fatty foods, things like that will cause your healing and your recovery time to be lengthened. And that does put you at risk for other things that happen. So I really wouldn't qualify it as a diet issue.
Well, see, I was thinking that it was, in terms of diet, meaning...
I will say that majority of my patients who require amputations are either diabetics or they have a history of smoking.
Right.
Those are the people who the circulation is poor. And once the circulation is poor, if there is an injury, say, for instance, an ingrown toenail, something as simple as that, or a little crack in between the toes, that should heal within a couple of days. But because you now have expanded that because you smoked and your arteries are clogged or you're diabetic and it's full of sugar, it may take you 2 months or so to heal from that one thing. And so that makes you more susceptible for other things.
But I remember we had a conversation once and you were saying that sometimes patients will want to come in for a surgery or something and they don't really need it.
Yes. I would say majority of females will come in for what we would consider a cosmetic surgery. So bunions, hammer toes, things like that. And yes, you may have that, but if it's not painful, I think that's one of the
And hammer toes are just like corns, right?
Yeah, well, the toes that curl. So if they curl, and eventually you can get a corn because of that, because of the curling. But I mean, a lot of the females come in, they want their toes straight, and it's fine to want that. But I think that people assume that you may not have any pain afterwards, and so I typically do not do what we call cosmetic surgery, because again, surgery is to make it functional, but I can't say that it's going to be completely pain-free. And if you already don't have any pain, if I now cut you open and your toe is straight, but it's hurting,
it's going to be painful, yeah.
Who wants that?
Right.
So I don't do that. And there are some physicians that will do that, but I stay away from that. I don't need that headache.
All right.
I think for me, the most important thing is that people not wait until it's too late. When it comes to the foot, usually you'll have warning signs, whether or not it's pain or discomfort or a little tingling or burning, or even the presence of a corn. That shouldn't be there. And so that's a precursor that something is potentially brewing. That's one thing. And then women with pedicures, I am very, very cautious when people tell me that they go to pedicure spas, because a lot of my patients have come out with nail fungus in the toenails, or fungus, warts, things like that on the skin.
Wait, fungus is one thing and then warts is separate, right?
Correct.
Okay.
So you can have like athlete's foot.
Right.
Warts. Of course, people can cut their nails wrong, then they get an ingrown toenail. So
right. Now, how do you get a wart from the pedicure? Because don't you have to rub against the skin? Don't you have to touch?
If there's a break in the skin, then
so it doesn't have to be like contact, skin on skin contact.
No.
Okay, because I was thinking in terms of like a genital wart, like like a genital wart. You can just basically, the skin can touch.
No, usually if there's a break in the skin and there is the virus is there within, whether or not it's in the bowl or whatever, if you step on that, a lot of people get warts from communal places like swimming pools.
People walking in the gym without shoes on, that's
Correct.
the most disgusting thing.
And one of the things I think people don't realize is that when you go to hotel rooms, you should not walk around barefoot in hotel rooms. They did a study and they showed so many bacteria, yeast, molds, all kind of stuff that are in the carpet.
Walking around on the carpet.
Yeah.
So the wart, like if you get a wart on your foot or on your toe, I'm sure that's painful, but can you remove it?
You can.
Okay, so they can be removed.
Yeah, they can be surgically removed. They can be excised, or you can pare them down and do like cold therapy, like freeze them off.
Yeah, like freeze them off, yeah.
You can do a chemical burn.
Which you can buy over the counter.
Yeah, it depends on how deep it is. But usually when they're on the bottom, they're pretty much impacted into the skin. So people can't just put
You can't just freeze it off.
No.
Oh, so you got to actually go into the skin and cut it out.
Yeah.
And what?
Excise.
Oh. Technical term. Excise it out. Oh, okay. And so how long would something like that take to heal? Like if you've gone, I guess it would depend on how deep it is.
It depends. But usually the plantar skin, it takes about 3 or so weeks to heal because it's so thick.
The plantar skin, for those of you listening, again, is the skin on the bottom of the foot.
Sorry.
She's just talking like y'all just in podiatry. I just know because I'm pretty smart. But
Okay.
I don't mean to toot my own horn, but beep, beep. No, I'm just playing. But, okay. But no, it's funny because many years ago, I had a fungus on my big toenail from going to those pedicure places. Mm-hmm. And it took forever for it to get away, for it to go away. And I didn't want to try anything like Lamisil or anything like that because, it can affect your kidneys and stuff like
liver,
that.
But yes.
Yeah, your liver, yes. But what happened was one day I was in a Caribbean grocery store. And I don't even know how I started talking to this woman, but it was a West Indian woman. I think she was from like Barbados. And she told me to get some fresh aloe. Now, you don't see fresh aloe in the regular grocery store. But in that West Indian store, it was like an international grocery store I was in. I was in Atlanta. I was back in Atlanta. And I went and got me one of them aloe. I bought like a stick. Mm-hmm. And I just cracked it up. And, you just get the little gel and you put it on. She said, just put it on there as often as you think about it. But up to that point, I had been also putting tea tree oil on it. Yeah. So I was doing tea tree oil on it. But, I don't know if that was really working. I was doing a combination of things. I was doing the tea tree oil. I would put the tea tree oil on it. Then I would put the aloe gel on it. But then I'd also gone to this natural store in Atlanta where they have these pills. They had these pills that I was taking. And again, I didn't want to take anything as harsh as like a Lamisil, but I was taking these pills. I don't remember the name of them, but I had asked somebody in the store if there was something for like a fungus. And she said, well, you're really going to have to get something that's going to... Because the fungus is not always topical. It's about, it's usually about the bloodstream. You got to get it from the bloodstream.
Correct. When it comes to nail fungus, because the fungi are actually underneath the toenail.
Right.
Topicals are not going to be able to penetrate that.
Correct.
Unless you take, now I have had a patient who wanted her nail fungus gone so much that she
had her whole toenail taken off.
All 10.
All 10 of her toenails?
All 10.
She had fungus on all 10 of her toes?
She wanted them all taken off.
She had fungus on all 10 of her toes?
All 10 of her toes, Craig.
How did she get fungus on all 10 of her toes?
I mean, it's common. It's very common. Fungus is very common.
Now, how do you get fungus, though, like that? Now, I got mine from the place, I believe.
You can have it from trauma. Somebody introduces the fungus into your situation. Or you can get it from repetitive trauma. When you stub your toe or something falls on it, essentially the nail lifts up. Mm-hmm. Indirectly. And once it does that,
stuff goes in.
It goes underneath it. And so that's the environment has bacteria, yeast, molds, and fungus. And so that's how you get it underneath your toenail.
Except once you get out of the shower and you don't completely dry between your toes.
As you should, though.
Oh, I do. Trust. Okay. I do it several times because I don't, you know what I'm saying? But what does that create? Doesn't that create a fungus between your toes?
Yeah, athlete's foot. So it's dark and moist and it's dark and it's a breeding ground.
Yeah, and then a lot of times people wear dark socks.
Right.
Because they often tell you that when you're working out that you shouldn't wear dark socks because you're sweating.
Right.
And your toes, and then because the fungus or whatever.
Well, it just adds. It's a perfect
breeding ground because it's dark and it's moist and
now it's wet because you're
it's wet.
Yeah.
Well, moist means dark.
Well,
so.
Moist does not mean dark.
I mean, moist means wet. Moist means wet. You knew what I meant. Moist means wet. Anyway, back to what I was saying about the pills that I was taking. So I was doing a combination of things. So I couldn't tell you if it was the aloe that worked, but I did all three of those things, the pills, the aloe, and the tea tree oil, and next thing I know, it was gone. But I put that I put that aloe on my toe every time I thought about it. Like if I was just sitting at home, I would just go and get some and I put it on there. And then it would dry, because it dries up and then I would put some more on there. Like if I was just sitting at home, I just kept putting it on there all day. And then when I got in bed at night, I'd put some on my toes and I'd put a pair of socks on, like, a pair of white socks. And I would just cover my toe, cover my foot so that it could be on there through the night. Like I used it as often as I could think about it.
Well, there are a lot of herbal, I would want to say, kind of treatments that people do. Some people do Vicks Vapor Rub.
Oh yeah, I think I did that I did that too.
Bleach.
Yeah.
I mean, technically, there's no literature that says, okay, that's an antifungal, which is what you would look for to get rid of fungus. But if it works, it works. I don't.
Yeah, I had started with that before I ever ran into that lady in that grocery store. I started with Vicks Vapor Rub because supposedly the menthol.
Well, it softens up the nail because most of the time when people have nail fungus, the nail is very thick and it's hard and it's difficult for them to cut, and so they're looking for any kind of relief to be able to cut the nail, and so the Vicks will soften that up.
So back to this lady who had all 10 of her toenails taken off. Did her toenails ever grow back?
They did.
But
they weren't as fungal because initially, in addition to that, she did topical. I mean, this woman was like a heavy hitter. She wanted to do the topical as it grew back out.
So you gave her something for that?
Yeah, and essentially that's over the counter. But then she also did the Lamisil.
Okay, which is,
the oral medication.
Yeah, the oral
So she was doing it from oral. She was doing orally and she was doing topically, and there was no barrier for her to get access to put the antifungal on there. So, it wasn't completely clear.
So she was able to put the antifungal directly on.
Correct, on the nail bed.
The nail bed, yeah.
Right.
Oh my
But that's risky because now essentially you have nothing to protect you.
Absolutely.
So unless you're going to be committed to doing that, it's.
Because what kind of care does she have to take of her toes? Like, does she have to wear special socks or something?
No, essentially you don't have to have toenails.
Yeah, I know, but it didn't put her at risk of getting another fungus or something?
It did, and she was aware of that.
That's what I'm saying.
She
So
was
how do you...
committed. She took on that ownership. I gave her the risk, the pros and the cons, and I say, okay, yes, you're going to now have direct access, and you'll be able to put the medication on there, to which it will make it more effective. However, if you forget or something happens, you now have basically opened the door to all kind of things to get on.
If she forgets to put the
medication on there,
so she needed to do that every day.
Correct. And that was her due diligence to do, not mine. So.
Right. So were her toenails black?
They weren't black, but they were definitely darkened.
Yeah.
Yeah. So. But yeah, most people come in for that nail fungus. Routine care is like nail fungus. People have like arthritic pains, bunion pains. Sometimes people have neuromas, which are basically like tumors of the nerve endings. There's a whole host of things that I see on a regular basis, but probably the most common things are bunions, hammer toes, plantar fasciitis, ingrown toenails, and nail fungus.
But you also get into neuropathy.
Correct.
Would you like to explain to the people
what
neuropathy
basically means, they're basically the nerve has a outer layer or sheath that basically encapsulates the nerve ending. And when that is damaged, whether or not it's severed or whether or not medication happens, there's a whole host of reasons why you can get neuropathy. But essentially, you lose the sensation and the feeling in your feet.
And so it's kind of like a throbbing of the feet, to kind of describe it can needles feel like tingling.
It can be tingling. It could be burning. It could be complete absence of anything. There's a whole host of things the symptoms that you can have when you have neuropathy.
Because I dated a guy, this was many years ago. If you guys read my first book, Words Never Spoken, Salim was HIV positive, and I only speak about that openly because he is now passed on. But
oh yeah.
Well, if you didn't read the book, then I'm sorry, I kind of spoiled that for you, but it's still a great read. But yeah, he had neuropathy, but it was one of his medications that caused it. Because one of those HIV medications causes neuropathy, and I remember him complaining about his feet tingling, and he couldn't stand the feeling of this tingling. And so that was how I became aware of neuropathy.
Well, yeah, a lot of people with medication, especially also with people who have cancer. A lot of my cancer patients develop neuropathy, and they also develop nail fungus. I don't know what the correlation is, but that I do see that often. So
are the cancer patients getting neuropathy from the medication? Some medication that they're on?
I believe so, yeah. I can't put the etiology by it. When they come to me, they tell me that they're seeing an oncologist and that they're having numbness and tingling, and usually is related to the medication, but not always.
So are there any final words for us that you'd like to share with us, and why it's important to really, and how often should you have your feet checked?
Well, first of all, you should check your feet every day.
I mean by like a doctor or something. You're not like you're supposed to go to the dentist every 6 months. You know what I'm saying?
Well, if you don't have any issue and you're wearing good shoes, again, your feet will give you an indication.
Now, good shoes does not mean Louboutins, okay?
No, and I only wear them for a short time. Because, you really can't walk
Good
in
shoes, you mean by shoes that are very much so...
They have a wide toe box. They have adequate shock absorption.
Now, that does not mean wear square toe shoes.
Square toe shoes are actually the better.
I'm talking about for men. Like, that's country.
No one does that?
Not anybody with style.
You do a taper toe?
Well, you want a slight round pointed toe.
Not a round pointed.
But slightly round. Anybody wearing no square toe shoe, okay?
Well, catch me in 30 years. You'll be wearing square toe.
No, I'll have somebody carrying me around before
I'm not carrying you around.
So you should check your feet every day, obviously.
Yeah, I mean, most patients who don't have any issues, they come to me like once a year. Just to check their shoes, especially if they're athletic. They want to make sure. Those people are very much concerned about their shoe gear.
So you should, I mean, and we're not saying that you can't get pedicures. You just have to go to a place where they're sure to clean the stuff because, like, I appreciate going to a place where they put that little plastic
bag,
that
in
little
addition
liner.
to that, I usually advise my patients to, if they have to go, because some people just have to go. If you have to go, I would take your own instruments because I've gone there, and of course they put them in the little sterilization pack. And I checked it out; those sterilization packs are not sterilized. There's supposed to be an indicator on there. In addition to, you're supposed to do a cold sterilization when you soak it in a liquid first, then you put it into the hot autoclave, and they don't do that.
So you went in there and checked those people's machine. And what'd you say?
I said, "Oh, can I see that pack? That's interesting. I'm so glad that you guys do that." Just to see if it was an actual clean pack.
And it wasn't.
And it was not.
This was here in the district?
This was in Maryland. I don't really travel in the district. I don't like the one-way.
So you didn't go there anymore?
Well, of course not.
So you didn't even let them do your feet that day?
Of course not. Well, I don't really have them do my feet. I usually do my own, and then I may go for them to put the polish on there or something like that. I can do my own feet.
So why haven't you ever done my feet?
Well, you never asked me.
I would love to have my feet done. So how do we?
I mean, I do Richard's all the time, actually.
That's her husband. So wait, how do you know what to look for then? I mean, because you can't say that you just go to a fancy schmancy place because that doesn't guarantee that they're
of course
cleaning
not.
their stuff.
Well, that's why I say take your own stuff.
Well, how am I supposed to know what all I need to carry over to the place?
You've gone there and you've had it before. You see the instruments that they get.
Because I'm gonna tell you the thing that has bothered me. You know that little sponge that they use? It's like a loofah thing, and they scrub the bottom of it. They don't change that. They use that on multiple people.
And the nail files too.
And the nail files. You're right. Oh, you're gonna cause me not to go and get my feet done.
No, you just take your own stuff. I mean, they can do it. You just bring your stuff. They do it.
So what are the things that I need to take? I need to take the little clipper.
The clipper, you may want to do it now. And also, do not cut the cuticles. People should not cut cuticles. I don't know why.
Even on manicures. That's why I don't get manicures. People think that I get manicures, but I don't. My hands are just like this.
You can push them back, but you're not to cut them.
You're not supposed to cut them.
That is a barrier. That keeps, and that's how some people do get fungus in their toenails because they cut that, and essentially now it's an open door. Don't cut your cuticle. So you can take a cuticle pusher if you want a cleaner look.
Right.
Of course, the nipper and a file essentially is all you need.
They definitely don't.
They don't
change that.
And
yeah.
they're not. They don't. I don't think they have to. I think there's a level of precaution that they have to do, but because it's not a medical facility, they don't have the same standards.
And they don't have like people watchdogging.
No, they're just looking for it. Now they have to have that little. I forget what the little blue. Medication is, liquid that they put the instrument in. It's like same thing when you go to the barber.
Sanitizer.
They use that, and sometimes I've gone to places. It's supposed to be at a certain level. It's supposed to be submersed. They don't have it always like that. Sometimes it's there, sometimes it's not. It's like 2 drops.
It's supposed to be submerged.
You
said submersed.
Oh, well, can we edit that out?
No, I want to leave it. I want to leave that.
No, we're not.
No. I want to leave. Yeah. I want to leave that there. Yeah. But you know,
you see how you do me?
but here's the thing, and I thought I was doing something by going in there and making them clean it, because like there's a place that I go to near my house. They don't have those little bags that they put in there, but I always call myself having them clean it while I'm sitting there. They're like, "Oh no, it's already clean." I'm like, "No, but I need to see you do it."
But you do know that in order to really properly clean it, it has to be cleaned, or they need to clean it for at least 10 minutes.
What? Listen, they not doing all of that.
Well, then it's not clean. Because even when I had, I used to work in a place that we would have patients come in, especially like the elderly people. They like to soak their feet. Okay. So we would have this basin and they would soak their feet in there. And when I say the guidelines to make sure that is completely as clean as possible is like ridiculous.
Really?
That's why most podiatrists don't do that anymore, because it's just too labor intensive.
Right.
And then insurance doesn't pay for it anymore. But I mean, it's a lot to make sure that when you put your feet in there, that's clean. So if they're not cleaning it, it's not, 10 minutes of
They're
cleaning,
not cleaning that for 10 minutes.
That little tooth spray and
that little swish around
towel,
that they do.
No, ma'am. Mm-mm. See, that's why I don't have them do that. I do my own toenails, and they can put the
And so the
polish
only
on.
thing you do is go in there and just let them put the polish on. Well, why not just buy the polish and put it on your damn self?
Because they do it nice and smooth. And then sometimes I do gel. It depends. But they do it nice and smooth and even. And of course, I like the foot massage and all that.
Yeah.
But I mean, I'm not going to put myself at risk for that. And of course, I mean...
So you'll let them do the foot massage, but you're not submerging your feet in the water.
Correct.
And in the bowl.
Correct. My feet are ready to go when I get
So you come in for a pedicure and be like, well, no, I don't want a full pedicure.
No, I just say I want a polish change.
And then you said you can massage my feet.
Mm-hmm. I want a polish change and I want a massage. That's what I get.
Listen, if this is your first time listening to someone to say, be sure to hit the subscribe or follow button. And don't forget, Book of Jewels has made its debut. So
you didn't talk about my blog?
Oh, see, I asked you if there was anything else you wanted to talk. Okay, tell these people about your blog.
Okay, so part of the thing that I did with my blog is that, like I said before, I go to senior places. And when I say that they have some amazing stories, and a lot of times I think that when I come to see them, they haven't talked to people in I don't know how long. The family doesn't come and the staff doesn't really talk. So when I see them, they're ready to just spill the beans. Right. And when I say I've gotten so many good jewels, you talk about Book of Jewels, I've gotten so many good jewels and pearls from just listening to them. And so my blog is basically like a bridge, because I feel like the younger generation doesn't really talk to the older generation, and they have so much wisdom and expertise, and a lot of things that they have gone through, we go through ourselves. It may not be identical, but love, loss, family issues, and so the blog definitely talks about that, and so I really, really enjoy doing that.
And what's the blog? Give us the web link.
The web link is Life's Footprints.
I'm gonna put, guys, it's down in the description. Life's Footprints. LIFES footprints with an S.com.
Yeah.
All one word. But I'm going to put I'll put it down in the caption so you just click on it. And so it's just these stories. And so you write these stories.
Now, it's not the full entire story. It's just a snippet of the story. Right. The story is longer. But yeah, the key points.
And how often do you, so when you guys subscribe, how often can they expect to get?
Oh, well, I'm doing a little bit better. It's supposed to be every 2 weeks, but my schedule's crazy. So I try to do it at least once a month.
Right. Well, that's good.
Yeah.
Okay. All right. And do you have your Twitter set up?
I'm setting it up. It is Life's Footprints.
All right, guys. Listen, don't forget Book of Jewels is available now. It's available on Audible. Yours truly is narrating. It's also available on iBooks as well as Kindle and all of the e-readers. If you want to purchase an autographed copy, you can purchase directly from my website. Yes, in 2020, we are stepping up. Okay, you can go directly over to CraigTheWriterStewart.com. You can click on Shop at the top, and you can just purchase whichever book you want. We have 4 now. And then the book tour is available on the website as well. So just click on the button that says tour, and I just may be in a city near you. Thank you for listening. Please don't forget to subscribe or click the follow button. And please share this podcast with your friends, your family, and your network. We're here each and every Monday at 10 a.m. You don't have to be live listening because we're not live, but the show's archived. So be sure to go ahead and hit the follow or subscribe button. I like to leave that B out and subscribe. I usually say subscribe.
Like me and submerge.
Right. Well, you said submerge. I say subscribe, but subscribe. Be safe. Keep loving yourself. When I released my first book, I remember thinking very heavily about Elon Harris and how he did it, how he managed to reach millions of people around the world through his work, and how I would do it. His readers became my readers. I write because it's my passion. I write with black people on my mind and black gay men in my heart. Toni Morrison gave me the courage to say that out loud.
Yes, I can write about white people. White people can write about black people. Anything can happen in art. There are no boundaries there.
I could write about anything, anyone, but I choose to write about our experience.
And I've spent my entire writing life trying to make sure that the white gaze was not the dominant one in any of my books.
Book of Jewels is my love letter to black people.
It has nothing to do with who reads the books. Everyone, I hope, of any race, any gender, any country.
Book of Jewels is 11 of the biggest life lessons that I've learned to date, and the stories behind those lessons. Book of Jewels is available now on Audible, all e-readers, and Amazon.com. Visit www.CraigTheWriterStewart.com for more information. When I released my first book, I remember thinking very heavily about Elon Harris and how he did it, how he managed to reach millions of people around the world through his work, and how I would do it. His readers became my readers. I write because it's my passion. I write with black people on my mind and black gay men in my heart. Toni Morrison gave me the courage to say that out loud.
Yes, I can write about white people. White people can write about black people. Anything can happen in art. There are no boundaries there.
I could write about anything, anyone, but I choose to write about our experience.
And I've spent my entire writing life trying to make sure that the white gaze was not the dominant one in any of my books.
Book of Jewels is my love letter to black people.
It has nothing to do with who reads the books. Everyone, I hope, of any race, any gender, any country.
Book of Jewels is 11 of the biggest life lessons that I've learned to date, and the stories behind those lessons. Book of Jewels is available now on Audible, all e-readers, and Amazon.com. Visit www.craigthewriterstewart.com for more information.